to slow down together. Let the air fill your lungs completely, and now release it slowly, letting go of the day behind you. Tonight, we're going to explore something truly restorative: how to create a simple nighttime skincare routine that feels like a gentle transition from the busy world into rest. Nighttime skincare is different from your morning routine. In the morning, you're preparing and protecting. At night, you're releasing and repairing. You're helping your skin let go of everything it encountered during the day, and you're supporting its natural overnight renewal process. This is your skin's time to breathe, to heal, to regenerate. Think of your nighttime routine as a bridge between day and night, between doing and being. It's a few quiet minutes that belong entirely to you, a small ritual that signals to your body and mind that it's time to transition into rest. This isn't just about skincare. It's about honoring yourself at the end of each day. Let's begin with the most important step of your nighttime routine: removing everything your skin collected during the day. Throughout your waking hours, your skin has been exposed to so much: makeup if you wear it, sunscreen, which we hope you applied this morning, environmental pollutants, tiny particles of dust, exhaust, and debris that settle on your skin, natural oils and sweat that your skin produces, dead skin cells. All of this needs to be gently removed before you sleep. This is why cleansing at night is non-negotiable. Unlike the morning, when you might skip cleansing or just splash with water, nighttime cleansing is essential. You must remove the day from your skin. If you go to sleep with all that buildup still on your face, you're preventing your skin from breathing and regenerating properly. Pores become clogged, skin becomes dull, breakouts occur, all because the day's accumulation was never washed away. But here's the beautiful part: cleansing can be a deeply calming experience. It doesn't have to be rushed or mechanical. Let it be intentional. Let it be peaceful. If you wear makeup or heavy sunscreen, you might benefit from a two-step cleansing process. This is often called double cleansing, and it's wonderfully effective. The first cleanse removes the surface layer, the makeup, sunscreen, and oil-based debris. The second cleanse actually cleans your skin. For your first cleanse, use an oil-based cleanser, cleansing balm, or micellar water. These products are specifically designed to dissolve makeup and sunscreen without harsh scrubbing. Take your time. Massage the cleanser onto dry skin using gentle circular motions. Feel the makeup dissolving, the sunscreen breaking down. There's no rush. Let this be meditative. If you're using an oil cleanser or balm, add a little water after massaging. The cleanser will emulsify, turning milky. This is exactly what should happen. Rinse thoroughly with lukewarm water, making sure you've removed all traces of the cleanser. If you're using micellar water, simply wipe gently with a soft cotton pad until no residue remains. Now comes your second cleanse, your true cleanse. Use your regular facial cleanser, the same one you might use in the morning, or perhaps something slightly more thorough for evening. This cleanser is working on clean skin now, able to really cleanse your pores and remove any remaining impurities. Apply the cleanser to damp skin. Massage it gently across your face, your jawline, your neck. Use soft, upward circular motions. This isn't about scrubbing. It's about thoroughness and gentleness combined. Pay attention to areas where oil and debris tend to accumulate. Around your nose, along your hairline, under your chin. Rinse thoroughly with lukewarm water. Make sure no cleanser residue remains, especially along your hairline and jaw. Then pat your face dry with a clean, soft towel. Use pressing motions, not wiping. Your skin is clean now, fresh and ready for the next steps. Here's something important. Your towel should be clean. Ideally, use a fresh towel every few days, or even have a dedicated face towel that you change frequently. A dirty towel can reintroduce bacteria to your freshly cleansed skin, undoing all your good work. After cleansing, your skin is at its most receptive. This is the optimal time to apply treatment products because they can penetrate deeply and work effectively while you sleep. Your skin's repair processes are most active during sleep, so nighttime treatments can be especially powerful. If you use a toner, apply it now. Toners can help balance your skin's pH after cleansing and prepare it to absorb the products that follow. Soak a cotton pad or simply pour a small amount into your palms and press it gently onto your skin. Choose a hydrating, soothing toner. Nothing with harsh alcohols or astringents that will dry out your skin. Next come your treatment serums. Nighttime is when you can use more active, targeted treatments because you won't be exposing your skin to sun immediately afterward. If you have specific concerns, acne, dark spots, fine lines, this is the time to address them. A hydrating serum with hyaluronic acid can help your skin retain moisture overnight. A retinol serum can support cell turnover and collagen production, though you should introduce retinol slowly and carefully and always use it at night. A niacinamide serum can help with pore appearance, skin texture, and oil balance. Choose what your skin needs most, but remember, you don't need to use everything. 1 or 2 targeted serums are enough. Apply serums to slightly damp skin. Use just a few drops. Products are concentrated and you don't need much. Press them gently into your skin with your fingertips. Start at the center of your face and work outward and upward. Be gentle around your eyes. The skin there is delicate. Now we come to moisturizing. Nighttime moisturizer can be richer than what you use during the day because you don't need to worry about makeup going on top or your face feeling greasy. Your skin can handle, and often benefits from, a more nourishing formula at night. A good night cream provides intense hydration and helps seal in all the treatment products you've just applied. It also prevents transepidermal water loss while you sleep, keeping your skin's moisture levels stable. Choose a formula that feels comfortable but nourishing. It might be a rich cream, a sleeping mask, or even a facial oil if your skin is very dry. Apply your night moisturizer in gentle upward motions. Use a little more product than you would in the morning. Your skin has all night to absorb it, and it needs that extra nourishment after a long day. Don't forget your neck and décolletage. These areas need nighttime care just as much as your face does. If you use an eye cream, apply it now. Nighttime eye creams can be richer and more targeted than daytime formulas. They might address puffiness, dark circles, or fine lines. Use your ring finger to tap the cream gently around your orbital bone. Never rub or pull the delicate eye area. Some people like to add a final occlusive step, a product that creates a protective seal over everything else. This might be a sleeping pack, a facial oil, or even a thin layer of petroleum jelly on particularly dry areas. This step is optional, but it can be wonderful if your skin is very dry or if you live in a dry climate. Now let's talk about timing. Your nighttime routine will take longer than your morning routine, perhaps 10 to 15 minutes. But this isn't wasted time. This is sacred time. This is you honoring your body, releasing the day, preparing for rest. Try to do your skincare routine at least 30 minutes before you actually go to bed. This gives products time to absorb fully so they don't transfer onto your pillowcase. It also helps establish a clear boundary between your active day and your restful night. Skincare, then perhaps reading or gentle stretching, then sleep. This creates a calming progression that supports good rest. Speaking of pillowcases, let's address something important. Your pillowcase affects your skin health. If you sleep on a dirty pillowcase night after night, you're essentially pressing your face into accumulated oil, bacteria, and dead skin cells for 8 hours. Change your pillowcase at least twice a week, or even more frequently if you have acne-prone skin. Some people prefer silk or satin pillowcases, which create less friction against the skin than cotton. Another thing to consider: try to sleep on your back if possible. Sleeping on your side or stomach means your face is pressed into your pillow for hours, which can contribute to wrinkles and puffiness. If you're a side sleeper, at least try to alternate sides. And make sure your pillowcase is always clean and soft. Your nighttime routine doesn't end with skincare. Everything you do before bed affects your skin. Are you drinking enough water? Dehydration shows up clearly on your face. Are you managing stress? Chronic stress triggers inflammation, which affects skin health. Are you getting enough sleep? Your skin literally repairs itself while you sleep. Shortchange your sleep, and you shortchange your skin's ability to heal. Before you sleep, take a moment to relax your face. Many of us hold tension in our facial muscles without realizing it. Clenching your jaw, furrowing your brow, tightening your lips, all of this creates lines and interferes with circulation. Gently massage your jaw joint. Smooth your forehead with your fingertips. Let your face be soft and relaxed. Consider keeping your bedroom cool and using a humidifier, especially in dry months. Your skin loses moisture while you sleep, and a humidifier helps maintain optimal hydration levels in the air around you. This small change can make a noticeable difference in how your skin looks and feels in the morning. As we come to the end of our time together, let's take a moment to appreciate what you've learned. Your nighttime skincare routine is an act of release and renewal. You're removing the day, nourishing your skin, and supporting its natural overnight repair. This simple routine, practiced consistently, is one of the most powerful things you can do for your skin's long-term health. Here's your simple evening routine in summary. Remove the day with a thorough cleanse. Perhaps double cleansing if you wear makeup or sunscreen. Apply treatment serums to address specific concerns. Moisturize with a nourishing night cream. Care for the delicate eye area if desired. And then transition into rest, knowing your skin is clean, nourished, and ready to repair itself while you sleep. Take one final deep breath with me. Hold it gently and release. Feel the day leaving your body. Feel the calm settling over you. Your skin is cared for. You are cared for. And now you can rest. Thank you for spending this peaceful evening time with me. May your night be restful, your sleep be deep, and may you wake with skin that feels renewed and refreshed. Until tomorrow, be well, be gentle, and let yourself rest completely. Hello, and welcome to this gentle moment of calm. Take a deep breath with me and let it go slowly. Today we're going to explore the beautiful foundation of healthy, balanced skin. There's no rush, no pressure, just soft guidance to help you understand how to care for your skin with kindness and patience. Your skin is remarkable. It's your body's largest organ, a living barrier that protects you every single day. It breathes, it renews itself, it adapts to your environment. And just like you, it deserves gentle attention and care. Many people approach skincare with anxiety or confusion, wondering if they're doing enough or perhaps doing too much. But the truth is simpler than you might think. Healthy, balanced skin doesn't require complicated routines or expensive miracles. It needs consistency, gentleness, and respect for its natural rhythms. Let's begin with the most fundamental principle. Your skin has an incredible ability to care for itself. It produces oils to keep itself moisturized. It sheds old cells and creates new ones. It has its own microbiome, a delicate ecosystem of beneficial bacteria that helps protect it. Your role isn't to control your skin, but to support these natural processes. Think of skincare as a partnership. You're not fighting against your skin or trying to force it into submission. You're working with it, listening to what it needs, and providing gentle assistance when necessary. The foundation of all good skincare begins with 3 essential steps: cleansing, moisturizing, and protecting. These 3 simple actions, done consistently and gently, are more powerful than any complicated routine filled with trendy products. Let's talk about cleansing first. Cleansing isn't about scrubbing your face until it feels tight and squeaky. That tight feeling many people associate with cleanliness is actually a sign of irritation. Your skin's protective barrier has been stripped away. Instead, think of cleansing as a gentle refresh, removing the day's buildup of oil, sweat, and environmental particles without disrupting your skin's natural balance. Choose a cleanser that feels comfortable. If your skin feels dry, tight, or irritated after washing, your cleanser is too harsh. A good cleanser should leave your skin feeling soft and calm, never stripped or uncomfortable. You might use a gentle, creamy cleanser, or perhaps a mild, foaming formula, whatever works for your skin type. The key is gentleness. When you cleanse, use lukewarm water. Hot water can strip away protective oils and cause irritation. Cold water might feel refreshing, but it doesn't cleanse as effectively. Lukewarm water is perfect. It's comfortable and effective. Massage the cleanser onto your skin with soft, circular motions. There's no need to scrub or apply pressure. Think of it as a gentle massage, not a deep scrub. And here's an important point. You don't need to cleanse your face multiple times a day. For most people, cleansing once in the evening is enough. In the morning, a simple splash of lukewarm water or a very light cleanse is often all your skin needs. Over-cleansing is one of the most common mistakes people make, and it can actually create more problems than it solves. After cleansing comes moisturizing. Every skin type needs moisture. Yes, even oily skin. Moisture isn't the same as oil. When we talk about moisturizing, we're talking about water content in your skin. Hydrated skin is healthy skin. It's plump, resilient, and better able to protect itself. Your moisturizer creates a protective seal that prevents water from evaporating from your skin's surface. This is called transepidermal water loss, and preventing it is crucial for maintaining healthy skin. Without proper moisturization, your skin can become dehydrated, which triggers a cascade of problems: dullness, fine lines, sensitivity, and even increased oil production as your skin tries to compensate. Choose a moisturizer that feels comfortable on your skin. If you have oily skin, you might prefer a lightweight gel or lotion. If your skin is dry, a richer cream might feel more nourishing. There's no single right answer, only what works for you. Apply your moisturizer to slightly damp skin if possible. This helps lock in extra hydration. The third essential step is protection, specifically sun protection. Sunscreen isn't just for beach days or summer months. It's a daily necessity, even on cloudy days, even when you're indoors near windows. Ultraviolet radiation from the sun is the single biggest cause of premature aging and skin damage. It breaks down collagen, creates dark spots, and over time can lead to serious skin problems. Think of sunscreen as your skin's shield. It doesn't need to be complicated. A simple, broad-spectrum sunscreen with at least SPF 30 applied every morning as the last step of your routine is enough. Reapply during the day if you're spending time outdoors. This one habit, practiced consistently, will do more for your skin's long-term health than almost anything else. Now, beyond these three essentials, what else does your skin need? Honestly, for most people, not much more. The skincare industry would like you to believe you need 10, 15, 20 different products. But your skin doesn't thrive on complexity. It thrives on consistency and simplicity. That said, there are a few additional elements that can support healthy skin when used thoughtfully. Gentle exfoliation once or twice a week can help remove dead skin cells and keep your complexion bright. But this should always be gentle. No harsh scrubs or aggressive treatments. A soft washcloth, a mild chemical exfoliant, or a gentle enzyme mask can all work beautifully. Serums can provide targeted support. A hydrating serum with ingredients like hyaluronic acid can boost moisture levels. An antioxidant serum with vitamin C can help protect against environmental damage. But these are additions, not requirements. Start with the basics first. Only add extra steps if your skin truly needs them. Let's talk about listening to your skin. Your skin communicates with you constantly. Redness,
severe acne. Preventing antibiotic resistance through early intervention with non-antibiotic treatments preserves antibiotic effectiveness if future antibiotics are needed. Starting with topical treatments rather than immediately jumping to oral antibiotics is prudent prevention approach. Education about acne myths prevents harmful behaviors. Teaching teenagers that acne results from poor hygiene, untrue, chocolate causes acne, unproven, or picking helps, false, prevents reinforcing these myths. Accurate education supports evidence-based prevention. Professional guidance for high-risk individuals might include dermatology consultation for those with strong family histories or early acne onset. Early professional involvement can prevent severe acne development. Guide 60, Acne Maintenance After Successful Treatment, the Forever Routine. Once you've achieved clear skin after acne treatment, maintaining clarity requires ongoing commitment to maintenance. Understanding long-term maintenance distinguishes between temporary acne control and permanent clear skin. The first principle of maintenance is recognizing that acne tendency doesn't disappear, it's managed. Your skin's predisposition to acne remains, but with appropriate ongoing treatment, acne stays controlled. This is similar to maintaining any chronic condition. You don't stop managing diabetes once blood sugar is controlled, you maintain management indefinitely. Maintenance routines are typically simpler than treatment routines. While treatment might involve multiple actives used frequently, maintenance often involves fewer treatments used less frequently. For example, someone might use salicylic acid daily and benzoyl peroxide daily during treatment, but maintain clear skin with just retinoid at night and benzoyl peroxide spot treatments as needed. Identifying essential treatments through your treatment experience guides your maintenance routine. Which treatments were crucial to your success? Continue those indefinitely. Which were helpful but not essential? Consider dropping these if your skin tolerates it, simplifying your routine while maintaining clarity. Seasonal adjustments remain important long-term. Winter might require slightly more moisturizing or reduced exfoliation frequency. Summer might require increased sun protection. These adjustments maintain skin health across seasons. Stress management, sleep, diet, and other lifestyle factors remain important long-term. While you might relax some during periods of stability, reverting entirely to poor habits causes acne recurrence. Maintaining reasonable health habits supports ongoing skin clarity. Monitoring your skin regularly allows early detection of potential recurrence. Monthly self-assessments identifying any new breakouts allows you to intensify treatment immediately if needed, preventing minor breakouts from progressing to significant acne. Having your dermatologist's contact information and willingness to contact them if acne recurs despite maintenance allows quick professional intervention. Don't try to solve recurrent acne alone for months, get professional help quickly. Keeping maintenance products on hand prevents running out and missing treatments due to product unavailability. Some people order backup products when current products are half empty, ensuring continuity. Reframing maintenance as self-care rather than burden improves adherence long-term. Your skincare routine is caring for your body's largest organ, supporting not just appearance but overall skin health and barrier function. The ultimate goal of maintenance is such consistency that skincare becomes automatic, habitual, and integrated into your daily routine like brushing teeth. At this point, maintaining clear skin requires minimal conscious effort. Guide 61: Understanding acne in specific sports and athletic activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62: Acne treatment during immunosuppression and immune compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne is common initially, particularly when starting retinoids or high-concentration treatments. Mild redness that resolves within a few hours is normal. Severe, persistent redness suggests your treatment is too strong. Reduce frequency or concentration. Use the sandwich method to reduce irritation. Apply soothing products like aloe vera or centella asiatica. If redness persists despite these measures, discontinue the treatment temporarily and consult your dermatologist. UV sensitivity occurs with retinoids, chemical exfoliants, and some other treatments. This doesn't necessarily mean you'll burn easily, but your skin is more susceptible to sun damage. Use SPF 30+ sunscreen daily, reapply every 2 hours if outside, and seek shade during peak sun hours. Wear protective clothing and hats if possible. This is non-negotiable when using photosensitizing treatments. Purging is temporary worsening of acne when starting certain treatments, particularly retinoids and strong exfoliants. Purging occurs as the treatment brings impurities to the skin surface and accelerates cellular turnover. Purging is usually a positive sign that your treatment is working, though it's unpleasant. Purging typically lasts 1 to 2 weeks but can persist up to 4 weeks. If purging lasts beyond 4 weeks or becomes unbearable, discontinue the treatment and consult your dermatologist. Contact dermatitis, allergic reaction, to products appears as itching, rash, or swelling. This is different from typical irritation. If you develop contact dermatitis, discontinue the product immediately. Identify the specific ingredient causing the reaction and avoid it in future products. Common allergens include benzoyl peroxide, sulfur, and certain plant extracts. Hormonal side effects may occur with spironolactone or oral contraceptives. Dizziness, lightheadedness, menstrual irregularities, and breast tenderness are possible. Report any concerning symptoms to your healthcare provider. Regular blood tests ensure your potassium levels and kidney function remain healthy if taking spironolactone. Sensitivity and compromised barrier function result from overuse of strong treatments. Your skin feels tight, uncomfortable, and is reactive to previously tolerated products. Manage this by stopping all actives temporarily and using only gentle cleanser, hydrating moisturizer, and sunscreen for 1 to 2 weeks. Allow your skin barrier to repair. Then gradually reintroduce treatments at lower concentrations and frequencies. Building tolerance to treatments requires patience and gradual progression. Start conservatively and increase gradually. This approach takes longer initially but leads to better long-term outcomes than aggressive starting that causes severe side effects and treatment discontinuation. Remember that slow, consistent progress is preferable to fast progress interrupted by side effects forcing you to quit. Guide 19: The Complete Long-Term Acne Maintenance and Prevention Plan. Once you've achieved clear skin, the challenge becomes maintaining clarity. Many people achieve clear skin only to abandon their routines, resulting in acne recurrence. Understanding long-term maintenance prevents this cycle and keeps your skin clear indefinitely. Continue your core routine indefinitely. The Cleanse, Treat, Moisturize, Protect routine that cleared your acne remains essential for maintaining clear skin. Don't abandon these steps thinking they're only necessary while acne is active. Your skin's tendencies haven't changed. Stopping treatment allows acne to return. Identify which specific treatments worked for you and continue them. If salicylic acid was crucial to your success, continue using it at maintenance levels, perhaps 2 to 3 times weekly instead of daily. If retinoids were essential, continue them nightly or at whatever frequency you use successfully. If benzoyl peroxide was key, continue it. Maintenance doesn't require the aggressive frequency you may have used during active acne treatment, but it requires continuing the treatments that worked. Simplify your routine for maintenance if desired. During active acne treatment, you might use multiple actives, but once clear, you can often maintain clarity with fewer products. For example, you might maintain clear skin using just retinoid at night and benzoyl peroxide spot treatments as needed, dropping the salicylic acid cleanser you used initially. Experiment to find the minimum effective routine for your skin. Monitor your skin monthly for early signs of breakout. Catching pimples at the very first sign and treating them aggressively prevents them from developing fully. Many people can prevent significant breakouts through early intervention with spot treatments when they notice the first small bumps. Keep your skincare routine on hand. Never run out of your essential treatments. Having spare bottles ensures you never skip treatments due to product unavailability. Some people order backup products when their current product is half empty, ensuring continuity. Identify your acne triggers through your skincare journal. Did acne worsen during stressful periods? After consuming certain foods? During certain times of your menstrual cycle? After skipping your routine? After trying new products? Understanding your personal triggers allows you to implement preventative strategies. If you identify stress as a trigger, prioritize stress management. If certain foods worsen acne, avoid them. If hormonal cycling causes breakouts, prepare in advance with more aggressive treatment during high-risk times. Seasonal adjustments may be necessary. Some people experience worse acne in summer, increased heat, humidity, sun exposure, or winter, dry air, heating systems. Adjust your routine seasonally, perhaps more frequent use of oil control treatments in summer, more aggressive moisturizing in winter. This flexibility maintains clear skin year-round. Maintain the lifestyle habits that support clear skin. Continue stress management, adequate sleep, regular exercise, healthy diet, and hydration. Don't revert to poor habits thinking your clear skin is permanent and won't be affected. Lifestyle factors remain important indefinitely. Schedule regular dermatology visits even after achieving clear skin. Annual checkups allow your dermatologist to assess your maintenance routine, adjust treatment if necessary, and catch any skin concerns early. Regular professional oversight prevents complications and ensures your long-term skin health. Handle occasional breakouts strategically. Everyone experiences occasional breakouts despite perfect routines, a particularly stressful period, new product irritation, or unknown trigger can cause isolated pimples. Treat these immediately with appropriate spot treatments. Don't allow occasional breakouts to discourage you into abandoning your routine. If you notice increasing breakouts despite consistent routine, assess what has changed. New products? Increased stress? Dietary changes? Hormonal changes? Identifying changes allows you to troubleshoot. Sometimes a simple adjustment, returning to a previous moisturizer, increasing stress management, or addressing dietary changes, restores clarity. For women, track your menstrual cycle and acne patterns indefinitely. If hormonal patterns are evident, you can prepare in advance during high-risk times with more aggressive treatment or preventative actions. Update your routine periodically based on new information. Skincare science evolves, new evidence-based ingredients and treatments emerge. While your core routine remains consistent, you might incorporate new additions. For example, if you weren't using sunscreen consistently but learn about new photostable sunscreen formulations, adding a good sunscreen enhances your results. However, don't constantly change your routine chasing new trends. Consistency matters far more than having the newest products. Have a plan if major breakout recurs. If despite your best efforts you experience significant acne recurrence, don't panic or feel you've failed. contact your dermatologist to identify what changed and resume professional treatment if necessary. Sometimes life circumstances.
Welcome to this healing space. Breathe deeply and let yourself relax completely. Today we're discussing how to reduce acne marks over time with patience, gentle care, and realistic expectations. Acne marks, also called post-inflammatory hyperpigmentation, are the dark spots that remain after a pimple heals. They're not scars. They're temporary discoloration caused by excess melanin production during the inflammatory process. The good news is that acne marks fade naturally over time, and you can support this fading process. Understanding acne marks helps you approach them with patience. When your skin experiences inflammation from acne, it produces extra melanin in response. This melanin deposits in the area, creating a dark spot. The mark isn't permanent damage. It's temporary pigmentation that will fade as your skin naturally turns over and sheds those pigmented cells. The fading process takes time. Lighter marks may fade in a few weeks to months. Darker marks can take 6 months to a year or even longer. This timeline varies based on your skin tone. Darker skin tones produce more melanin and marks can last longer. The depth of the original inflammation also matters. Deeper, more inflamed acne typically leaves darker, longer-lasting marks. Patience is essential. You cannot force marks to fade faster than your skin's natural cell turnover allows, but you can support the process and prevent marks from darkening further. The most important step in reducing acne marks is sun protection. UV exposure darkens post-inflammatory hyperpigmentation significantly and can make marks nearly permanent. Daily broad-spectrum sunscreen with at least SPF 30 is absolutely essential. Reapply if spending extended time outdoors. Without sun protection, no treatment will work effectively. Wear protective clothing, hats, sunglasses for additional protection. Seek shade during peak UV hours. Protect your marks vigilantly from sun exposure. Several active ingredients support mark fading by increasing cell turnover and inhibiting melanin production. Retinoids are highly effective for fading acne marks. They increase cell turnover, bringing fresher, less pigmented cells to the surface faster. Over-the-counter adapalene or prescription tretinoin work well. Start with 2 to 3 applications per week and increase gradually. Be patient. Results take several months. Always use with sunscreen as retinoids make skin more sun-sensitive. Vitamin C is a powerful antioxidant that inhibits melanin production and brightens skin. Use a serum with 10 to 20% L-ascorbic acid in the morning under sunscreen. Vitamin C provides both fading benefits and antioxidant protection. Niacinamide reduces melanin transfer to skin cells, helping lighten marks. A serum or moisturizer with 5% niacinamide can be used twice daily. It's gentle and provides multiple benefits, including barrier support and oil regulation. Alpha hydroxy acids like glycolic or lactic acid exfoliate the surface, removing pigmented cells and revealing fresher skin beneath. Use a product with 5 to 10% AHA 2-4 times weekly at night. Start slowly to avoid irritation. Azelaic acid has both exfoliating and melanin-inhibiting properties. Products with 10 to 20% azelaic acid can be very effective for post-acne marks and can be used daily or twice daily depending on formulation and tolerance. Koyic acid, arbutin, and licorice root extract are natural ingredients that inhibit melanin production. Look for products containing these ingredients for gentle brightening support. Layer these ingredients thoughtfully. You might use vitamin C in the morning with sunscreen and a retinoid or AHA at night with moisturizer. Don't use multiple strong actives simultaneously. This risks irritation without faster results. Chemical peels performed by a professional can accelerate mark fading. A series of glycolic, salicylic, or TCA peels removes pigmented layers faster than home care alone. Discuss this option with a dermatologist or licensed esthetician. Microneedling stimulates collagen production and can help with both marks and early scarring. Professional microneedling is more effective than at-home derma rollers. Discuss with a dermatologist whether this treatment is appropriate for you. Laser treatments specifically target pigmentation and can significantly fade stubborn marks. IPL, fractional lasers, or other technologies may be recommended by a dermatologist for persistent marks that don't respond to topical treatments. Prevention is crucial. The best way to reduce acne marks is to prevent them by preventing acne and treating it gently when it occurs. Don't pick or squeeze pimples. This increases inflammation and worsens marks. Treat acne early and consistently to minimize inflammation. Use gentle products that don't cause additional irritation. Be especially gentle with inflamed acne. Aggressive treatment increases inflammation and leads to darker, longer-lasting marks. Protect healing acne from sun exposure meticulously. Lifestyle factors support mark fading. Stay hydrated to support healthy cell turnover. Eat a diet rich in antioxidants, berries, leafy greens, colorful vegetables that support skin healing. Get adequate sleep when skin repair and regeneration occur. Manage stress, which can slow healing. Be patient and manage expectations. Acne marks will fade, but it takes time. Most marks fade significantly within 6 to 12 months with proper care and sun protection. Some darker or deeper marks may take longer. This is normal and not a failure of your routine. Don't expect overnight results. If you see gradual lightening over months, your routine is working. If marks aren't fading after 6 months of consistent care with sun protection and active ingredients, consult a dermatologist about stronger treatments. Distinguish between marks and scars. Acne marks are flat discoloration that will fade. Acne scars are textural changes, indentations, or raised areas that are permanent without professional treatment. If you have actual scarring, consult a dermatologist about treatments like microneedling, subcision, or laser resurfacing. Remember that some residual pigmentation is normal and natural. You're not aiming for absolute perfection. You're aiming for marks fading to the point where they're minimal and not bothersome. As we close, embrace patience. Acne marks will fade with time, proper care, and diligent sun protection. Support the process gently and trust that your skin will heal. May your marks fade steadily and completely. May you have patience for the healing timeline. May you protect your skin carefully as it heals. Thank you for this time together. Fade your acne marks gently, patiently, and consistently.
Doesn't mean failure. Restarting immediately prevents occasional lapse from becoming permanent abandonment. Guide 89, Acne and Sensory Sensitivities, Managing Treatment for Sensitive Individuals. Individuals with sensory processing sensitivities, common in autism, ADHD, and sensory processing disorders, might struggle with standard skincare routines. Adaptations help these individuals maintain treatment compliance. Sensory preferences vary individually. Some find strong scents overwhelming, others find unscented products leaving no sensory feedback. Understanding your sensory preferences guides product selection. Texture sensitivities affect product tolerability. Lightweight serums might feel pleasant while thick creams feel cloying. Smooth absorbing products feel better than sticky formulations. Temperature sensitivities might affect water temperature for cleansing. Some prefer cool water, others slightly warm, never hot, which damages skin. Routine predictability helps sensory-sensitive individuals. Consistent routines in consistent order reduce sensory overwhelm. Number 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. For confirmed acne cosmetica, switching to acne-safe alternatives of the product category often resolves the issue. Switching to non-comedogenic foundations, powder-based makeup instead of cream-based, or lighter formulations often allows makeup use without acne worsening. Reading ingredient lists helps identify potentially problematic components. Becoming familiar with ingredients triggering your personal acne helps you avoid them. Some people maintain lists of problematic ingredients to check against when considering new products. Patch testing new products on a small area, behind your ear or on your jaw, before full face application helps identify problematic products before they cause widespread acne. This 1 to 2 week trial prevents wasting money on products that trigger acne. The relationship between acne cosmetica and other acne factors is important. Someone might have both hormonal acne, from internal factors, and acne cosmetica, from products. Addressing both simultaneously, using acne-safe products plus treating hormonal acne medically, provides the best outcomes. Makeup artists and dermatologists can recommend acne-safe product alternatives for people who require makeup professionally. Many professional-grade acne-safe makeup lines exist specifically for people needing makeup without triggering acne. Guide 53, Acne Mechanica, Friction and Pressure-Related Acne. Acne mechanica results from friction, pressure, or occlusion of skin and can be prevented through environmental and behavioral modifications. Understanding acne mechanica helps you prevent this preventable form of acne. Acne mechanica appears where friction or pressure occurs, under helmet straps, where backpack straps compress skin, where tight athletic equipment contacts skin, or where repetitive hand-face contact occurs. This acne is localized to pressure-bearing areas rather than distributed across the face. Friction from repetitive skin-on-surface contact, athletes rubbing faces on towels, workers constantly resting their faces on hands, can trigger acne through mechanical irritation and follicle disruption. Occlusion, trapping sweat and bacteria under non-breathable materials, creates ideal conditions for acne. Wearing tight, non-breathable clothing or equipment increases acne in that area. Prevention strategies include wearing loose, breathable clothing, ensuring athletic equipment is clean, using protective barriers, adhesive taping where possible, between skin and friction sources, and maintaining good hygiene in high-friction areas. Post-exercise hygiene is crucial for athletes. Showering immediately after exercise, changing into clean clothes, and cleansing areas where equipment contacted skin helps prevent friction acne. Some athletes find that using antiperspirant before exercise reduces sweat-related friction and bacterial growth. Hairstyles causing friction, tight braids, tight buns, can trigger acne on the scalp and forehead. Occasionally loosening hairstyles, using gentler hair-holding methods, or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs since prevention is often simpler than treatment. Guide 54. Drug-induced acne and medication side effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible, or combining lithium with aggressive acne treatment, might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrol, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves hormonal surge of LH and FSH. Some women experience minor acne worsening around ovulation.
Welcome and breathe with me. In through your nose, out through your mouth. Let your body soften. Today we're exploring a powerful connection, the link between your stress levels and your skin's health. Your skin and your mind are intimately connected. They develop from the same embryonic tissue, and throughout your life, they remain in constant communication. What affects your emotional state affects your skin, and what affects your skin can influence your emotional well-being. This connection is so significant that there's an entire field of study dedicated to it. Psychodermatology. Stress isn't just in your head, it's in your entire body, including your skin. When you experience stress, your body responds with a cascade of physiological changes designed to help you face challenges. This stress response served our ancestors well when threats were immediate and physical. But in modern life, where stressors are often chronic and psychological, this same response can wreak havoc on your skin. Let's understand what happens in your body when you're stressed and how this affects your skin. When you perceive stress, your hypothalamus, a tiny command center in your brain, sets off an alarm system in your body. This triggers the release of stress hormones, primarily cortisol and adrenaline. These hormones prepare your body for fight or flight by increasing heart rate, sharpening focus, and redirecting resources toward immediate survival. For your skin, this means several things happen. Your body produces more oil. Cortisol stimulates your sebaceous glands to produce more sebum. If you're prone to acne, this excess oil can clog pores and trigger breakouts. Many people notice their acne worsens during stressful periods, exams, work deadlines, relationship troubles. This isn't coincidental. Your skin becomes more sensitive. Stress compromises your skin's barrier function, the protective outer layer that keeps irritants out and moisture in. When this barrier is weakened, your skin becomes more reactive, more prone to irritation, redness, and sensitivity. Products you normally tolerate might suddenly cause stinging or redness. Inflammation increases throughout your body, including in your skin. Chronic stress keeps your body in a state of low-level inflammation, which can worsen conditions like acne, rosacea, eczema, and psoriasis. If you have any inflammatory skin condition, stress often makes it flare. Your skin's healing slows down. Studies show that wounds heal more slowly in people experiencing chronic stress. This applies to acne lesions, minor cuts, and any other skin damage. Your stressed body is less efficient at repair and regeneration. You might develop stress-related behaviors that harm your skin. Picking at your skin, neglecting your skincare routine, eating poorly, sleeping less. These are common stress responses that directly impact skin health. blood flow patterns change. In acute stress, blood flow is redirected away from your skin toward vital organs and muscles. Over time, this can leave your skin looking dull and tired. Conversely, in some people, stress causes flushing and visible redness. Your skin's pH balance can shift, and its moisture retention capacity decreases. Stressed skin is often dehydrated, tight, and uncomfortable. Now, let's talk about specific skin conditions that stress can trigger or worsen. If you have acne, stress is likely one of your triggers. The combination of increased oil production, inflammation, and potentially stress-related habits like face touching creates perfect conditions for breakouts. Eczema often flares during stressful periods. The itching can intensify, and the affected areas can become more inflamed and painful. For many people with eczema, stress management is as important as topical treatments. Psoriasis, another inflammatory condition, commonly worsens with stress. Many people report that their psoriasis first appeared during a particularly stressful life period, or that flares coincide with stress. Rosacea can be triggered by stress-induced inflammation and blood vessel dilation. If you have rosacea, you might notice more frequent flushing and redness during stressful times. Hives can appear in response to acute stress in some individuals. These itchy, raised welts are a visible manifestation of your body's stress response. Even aging is accelerated by chronic stress. Stress breaks down collagen, the protein that keeps your skin firm. It generates free radicals that damage skin cells. It interferes with cellular repair processes. People who experience chronic, unmanaged stress often show signs of premature aging. The question becomes, how do you protect your skin from stress when stress is often unavoidable? The answer lies not in eliminating all stress, which is impossible, but in how you respond to and manage stress. First, recognize that your perception of stress matters. Two people can face the same situation and experience very different stress levels depending on how they perceive and interpret it. While you can't always control what happens to you, you can develop skills to manage your response. Breathing exercises are powerful and immediate stress reducers. When you're stressed, your breathing becomes shallow and rapid. Deliberately slowing and deepening your breath signals your nervous system to calm down. Try this. Breathe in slowly for 4 counts. Hold for 4 counts. Exhale for 6 counts. Repeat several times. Notice how your body softens. This simple practice, done regularly, can significantly reduce your stress levels. Regular physical activity is one of the most effective stress management tools. Exercise reduces cortisol levels, releases endorphins, your body's natural mood elevators, and provides a healthy outlet for stress energy. You don't need intense workouts. A daily walk, gentle yoga, swimming, or dancing all provide stress relief benefits. Sleep, as we discussed in a previous session, is crucial for stress management. When you're well rested, you're more resilient to stress. When you're sleep deprived, everything feels more overwhelming. Prioritize those 7 to 9 hours. Mindfulness and meditation practices help you develop a different relationship with stress. Instead of being overwhelmed by stressful thoughts and feelings, you learn to observe them with some distance and perspective. Even 5 minutes of daily meditation can make a difference. There are many apps and guided meditations available if you're new to this practice. Social connection provides powerful stress buffering. Spending time with people who support and care for you, sharing your concerns, feeling heard and understood. These experiences reduce stress hormones and activate your body's calming systems. Don't isolate yourself when stressed. Reach out. Find activities that bring you genuine joy and relaxation. Reading, listening to music, spending time in nature, creating art, playing with pets, whatever helps you feel calm and content. Make time for these things regularly, not just when you're already overwhelmed. Set boundaries around your time and energy. It's okay to say no. It's okay to protect your well-being. Chronic overcommitment is a major source of stress. Learn to recognize your limits and honor them. Limit exposure to unnecessary stressors when possible. If the news makes you anxious, limit how much you consume. If certain people consistently stress you out, limit contact if feasible. You can't avoid all stress, but you can eliminate some unnecessary sources. When you're stressed, your skincare routine can become part of your stress management practice. Instead of rushing through it, use these moments as a form of meditation and self-care. Feel the water on your skin. Notice the textures and scents of your products. Massage your face gently. These few minutes can be an oasis of calm in a stressful day. Your nighttime routine especially can signal to your body that the day's stresses are over and it's time to rest. This ritual helps transition your nervous system from activation to rest mode. Be realistic with your skincare during very stressful periods. If you can only manage the basics, cleanse, moisturize, sunscreen, that's okay. Don't add stress about your skincare routine to your other stresses. Do what you can and be gentle with yourself. If stress is triggering skin picking or other harmful behaviors, try to interrupt the pattern. Keep your hands busy with a stress ball or fidget toy. Apply a soothing product to your skin instead of picking. Acknowledge the urge without acting on it. These behaviors often happen automatically. Welcome to this calming space where we focus on nurturing your skin with gentle care. Before we begin, let's take 3 deep centering breaths together. Breathe in slowly through your nose, feeling your chest expand, and exhale gently through your mouth. Again, inhale peace and calm, and exhale any tension you're carrying. One more time, breathing in self-care and breathing out stress. Beautiful. Today we're exploring facial massage, a wonderful practice that combines relaxation with real benefits for your skin's health and appearance. Facial massage is one of the most overlooked aspects of skincare, yet it offers remarkable benefits when practiced regularly. Unlike quick product application, massage involves intentional, mindful touch that not only helps your skincare products work better, but also provides therapeutic benefits for your facial muscles, circulation, and lymphatic system. The best part is that you don't need any special tools or expensive products to begin. Your own hands and a few minutes of focused attention are all you need to start experiencing the benefits of facial massage. Let's begin by understanding what happens in your skin and facial structures during massage. Your face has a complex network of muscles, blood vessels, and lymphatic channels. Throughout the day, these muscles hold tension from expressions like frowning, squinting, and clenching your jaw. This tension can contribute to the formation of fine lines and can make your face feel tight or uncomfortable. Facial massage helps release this accumulated tension, promoting relaxation that shows on your face. Blood circulation in your face delivers oxygen and nutrients to skin cells while removing waste products. When circulation is sluggish, your complexion can look dull and tired. Massage stimulates blood flow, bringing fresh oxygen and nutrients to your skin cells. This increased circulation gives your skin a natural, healthy glow that's immediately visible after a massage session. Over time, improved circulation supports better skin cell function and renewal. Your lymphatic system is like your body's drainage system, removing excess fluid, toxins, and waste from tissues. Unlike your circulatory system, which has the heart to pump blood, your lymphatic system relies on muscle movement and external pressure to move lymph fluid. When lymph drainage is sluggish, you might notice puffiness, particularly around your eyes and along your jawline. Gentle massage techniques that follow lymphatic pathways help drain this excess fluid, reducing puffiness and promoting a more sculpted, defined facial contour. Facial massage also enhances product absorption. When you massage serums, oils, or moisturizers into your skin, rather than simply patting them on, you help them penetrate more deeply. The warmth from your hands and the pressure from massage movements improve how well your skin takes up beneficial ingredients. This means you're getting more value from the products you're already using, making them work harder for your skin. Beyond the physical benefits, facial massage provides emotional and mental benefits too. The act of touching your face with intention and care is deeply soothing to your nervous system. It's a form of self-care that signals to your body and mind that you're worth this time and attention. The ritual of massage can become a meditation, a few minutes where you're fully present with yourself, releasing the day's stress and tension through mindful touch. Now let's talk about how to perform facial massage effectively. Always start with clean hands and clean skin. You can massage on bare skin, but using a facial oil or rich serum makes the experience more comfortable and prevents pulling or tugging. The slip provided by these products allows your fingers to glide smoothly over your skin. Choose products appropriate for your skin type. If you're acne prone, use lightweight oils like rosehip or grapeseed that won't clog pores. Begin every facial massage session by warming the product between your palms. Rub your hands together to generate heat, which helps the product spread more easily and makes the initial touch more pleasant. Apply the product to your face with gentle pressing motions rather than rubbing, ensuring even coverage across your face and neck. You want enough product that your fingers glide smoothly without dragging your skin. The golden rule of facial massage is to always move in upward and outward motions. This works against gravity and follows the natural contours of your face. Moving downward can contribute to sagging over time, so be mindful of your direction. Use gentle to medium pressure. Your facial skin and muscles are delicate, so you don't need to press hard. The massage should feel pleasant and relaxing, never painful or uncomfortable. Let's go through a complete facial massage routine you can follow. Start at your neck, which is often neglected but holds significant tension. Using both hands, sweep up from your collarbone to your jawline with gentle, alternating strokes. Repeat this movement 5 to 10 times on each side. This helps drain lymph from your face downward toward your lymph nodes, preparing your face for massage. Move to your jaw and chin area, where many people hold tension from clenching or grinding teeth. Place your knuckles at the center of your chin and slowly glide them along your jawbone toward your ears, using firm but gentle pressure. Repeat this movement 5 times. Then, place your thumbs under your chin and your fingers on top, gently pinching along your jawline from chin to ears. This helps define your jawline and release tension. For your cheeks, make fists with both hands and place your knuckles at the sides of your nose. Sweep outward across your cheekbones toward your ears with moderate pressure. Repeat 5 times. Then place your fingertips at your nose and use small circular motions as you work outward across your cheeks. These movements help lift and contour your cheeks while promoting circulation. Around your eyes requires extra gentleness since the skin here is thin and delicate. Using your ring fingers, which naturally apply the lightest pressure, start at the inner corners of your eyebrows. Gently sweep outward along your brow bone, then circle around under your eyes, moving from outer to inner corners, then back up to where you started. This follows the natural lymphatic drainage pattern around your eyes. Repeat this eye circle 3 to 5 times, being very gentle to avoid pulling delicate skin. For your forehead, place your fingertips at the center above your eyebrows and sweep outward toward your temples. Repeat 5 times. Then, starting at your eyebrows, use your fingertips to make small upward strokes all the way up to your hairline, working from the center outward. This smooths forehead lines and releases tension. Finish by placing your palms on your forehead and gently sweeping them up into your hairline and down the sides of your face, a soothing motion that feels wonderful. Your nose and the area around it hold more tension than you might realize. Use your index fingers to trace small circles at the base of your nose, moving outward along the creases beside your nose. Then, using gentle pressure, sweep from the bridge of your nose outward across the top of your cheekbones. This area is prone to congestion and sinus pressure, so this massage can feel particularly relieving. Don't forget your lips and the area around them. Make a small O shape with your mouth and use your index fingers to trace tiny circles around your lips, working from the center outward. This improves circulation to your lips and can make them look fuller and more defined. It also helps smooth the fine lines that often develop around the mouth.